So in previous class, we started C group. So in C group, we completed C1, C2, and C3. So basically, where S1, S2, S3 is used, C1, C2, C3 also used, where structural damage occurs for healing purpose, okay, and as well as for tissue healing remedy. Okay, now we will talk about C4. So basically in S group, we have S4, but it is combination remedy, yeah, or compound remedy. But here C4 is original remedy. Here, Dr. Count Cesar Matti doesn't add any other remedy along with this. So why he maintained this remedy separately, and why he doesn't have uh, opposite S4 for functional? So basically here, in the C4, the basic explanation is that we have one structural thing that mostly our body depend upon those structures only. Then the function occurs. Here, uh, anything functional happen in other organs, function will affect the structure. But here, the structure affect the function. Okay, that's the reason he purely kept one remedy for the only structural purpose to keep the function properly. Okay, so we already know that in our body we have the skeletal system, those known as bones, ligaments, and we have uh, discs. Okay, so basically these are structural very important, because if their structure changes, then the function affects. So I will give you the example. If the bones are weak, okay, if the calcium is less in the bones, so here the structural changes occurs, then the function will doesn't have properly. The patient have pain while wake up, while walking, while standing, while sitting. Every time he or she have pain. Okay, so there is a reason he gave much more importance function than structure. He gave importance to the structure than functions. Okay, so C4 is specially designed to work on skeletal system. Whatever bone issues are there, you can add C4 along with other remedies. Okay, so basically C4 is designed for structural changes occurs due to the uh, calcium, phosphorus, other anything. Okay, so what C4 do? C4 do calcification. So wherever we need calcium, so it will reabsorb from the blood cells, and it also give the minerals to the bones, and as well as its another function is to do decalcification also, where we doesn't need calcium, phosphorus, or any other minerals. Okay, like we have any nodule. Nodule is a hard substance. So wherever you have hard substance, you want to dissolve it. Initially, you have to give as C4. Where initially you have to give C4. Then if the hardness went out, then you have to stop C4. Okay, so you want to calcification for the bones, you want to decalcify the hard nodule, you can use C4, which will give wonderful results, because it will work on mucosa. Okay, C4 not only work on bones but also work on mucosa. So mucosa, the hard tissue, the hard nodule, which is hardened due to the mucosa itself. Okay, so what it will do, it will release all the mucosa, which is the reason to become the nodule. So mucosa is released, so then the harden of the nodule is become soft. Okay, so there's the reason we have to use C4 there. Not only C4 itself used in this diseases, it's also used in kidney, urinary bladder, where we have cyst, hard cyst are there. You can use their GIT tract, okay, and we have respiratory tracts nodule. We can use there. So so basically, C4 not only for skeletal system, it is for kidney, urinary bladder, GIT, wherever necessary is there, and we have respiratory system. So these three systems also consider under C4. And another thing you have to remember about C4, that is it will work on mucosa. Okay, so that's the reason uh, he kept separately C4 because of this uses. So let's come to the plants. How many plants are there? We have 5 plants in C4. So what are those plants? First plant is Mencitoxicum officinale. Mencitoxicum officinale. And second was in Conium maculatum. Conium maculatum. Third one is Pimpinella saxifraga. Okay, those plants are seen in other families. And we have Rux toxicodendron. Rux toxicodendron. Next we have fifth one is Symphytum officinale. This is the special remedy in C for Symphytum officinale. So all these 5 plants are added in C4. So these 5 plants are very, very important. So you can give osteoarthritis, bone spores, cervical spondylitis, lumbar spondylitis, and we have cancer of bones, whatever chronic diseases where you need to treat the bones and the ligaments, and we have another soft tissue that is disc. Okay, so you can treat those things with the help of C4. So what are the other remedies along with C4 you can add, which you will give best results? One is F1, because you want to give Nervine effect, you have to add F1 there. And A2, you want to take the metabolic waste. So basically, when arthritis occurs, cervical spondylitis occurs, this inflammation. So what do you want to, you want to reduce the inflammation? First of all, you have to take the metabolic waste from that area, then the healing process will start easily. So that's the reason you have to add A2, waste, to remove the waste. Next, we have to add S10, because you want to increase the metabolism to the bones. So you need S10. Okay. So another remedy which can use because of the structural degeneration, that is Ven1, because both are for tissue remedy. This is the tissue remedy, and you can use for structural degeneration of the anything. So Ven1, C4 Ven1 is the good remedy. Okay, and electricities you have initially G is the best combination, because wherever bone problem occurs, so you can able to see there is inflammation, redness, swelling, okay, pains, and body have different structural changes while walking. Okay, so you will notice that. So G will help to cure this process rapidly. So inflammation decreasing. First A2 remove the metabolic waste. C4 S10 will improve the metabolism. So along with that, if you give C4 along with GE, it will improve the quality more rapidly. Okay, so you can add YE also initially, or WE also later stage, to maintain the same metabolism of C4. Okay, so this is all about C4 we discussed. So C4 is wonderful remedy for the bones along with other remedies. So now we'll discuss about C5. So in that, because already we studied about S5, so you know where S5 works. It is the metabolic remedy, first metabolic remedy. Okay, second, it will work on uh, liver because of the metabolism. And third is will work on ligaments and mucosa and skin. Okay, and we have tendon. All this will work under S5 function. But if structural changes occurs, then you have to add C5 also, because S5 for functional, C5 for structural changes. To heal the area, we need C group. We cure the area, we need S group. Okay. So what are the plants we have? Toxicum officinale, same plant, Toxicum officinale. How many plants? We have 5 plants. Toxicum officinale, Conium maculatum. Third one is Pimpinella saxifraga. Okay, and fourth one is Rux toxicotendron. And fifth one is Phytolacca decandra. Phytolacca decandra. So this is the main plant in C5. Okay, so it will work on metabolism for any, and the segments which are used in the D5, alternately it will work with the help of S5. So what are the other remedies you can choose along with C5, that is S5? Okay, or S5 will, if you want to choose S10. Okay, because of metabolism you have to choose L1 also. Hmm. And if any metabolism due to the genetical issue, so we have to add VEN1, and we have S12 also because of the eyes, to improve the structural changes, structural metabolical changes, we have to add along with, or alternately you can give S12. Only have GE and YE. So I already told you, mostly we take negative electricity along with C group. So this is all about C5. Okay. Next, we'll talk about C6. C6 is also the remedy of S6. Alternately, we will use, because S6 work on kidney, urinary bladder, and to remove the waste from the surface level of the body. Okay, metabolic waste. So you need not only from the body, from the cells, we need S6. So where the structural metabolical changes occurs, structural metabolic waste changes occurs, so we need C6 there. Okay, so we need C6 there along with S6. So what are the plants we have in C6? The total are 6 plants. In the C6, we have 6 plants. What are those? Toxicum officinale, 1 number. Conium maculatum, 2 number. Pimpinelli saxifraga, 3 number. Rux toxico, tendroin, 4th number. And Arnica montana. Here, the main plant is Arnica montana and Ledum palustre. Ledum palustre. So these are the 2 new plants added in C6. Then its function or the structural way of working is changed, totally changed. So kidney, urinary bladder, it will work wonderfully on kidney and urinary bladder. So what are the other remedies you can use along with C6. So basically, we have alternative. We know that C6 work with S6, C6 work with S6, and we have other things also. If you want to improve the lymph quality, because most of the waste products is coming from the tissues are in the form of lymph only. Okay, so there's the reason we added L1 here, and we have A3. Okay, A3 also to give the structural nutrition to the tissue level, whatever kidney, urinary bladder. So we add A3 here, and we have C17 to remove the toxicity, metabolic waste along with toxicity. Okay, and it will maintain pH level of the body in normal. Okay, normally it maintains C17 along with C6. They will maintain toxicity. Okay, and electricity is already I told you, GE and YE. So along with C6, you can use GE and YE. So we talked about C6, which will work on not only S6 work on functional part, and S6C the structural part of the kidney, urinary bladder. Okay. So now we will talk about compound remedy. Basically, till C1 to C6, we have all the remedies which are structurally have their function. But in C7, this is the compound remedy, combination of two remedies, that is C5 and A1. We already know that where S5 works for metabolism, C5 works structural metabolical changes, the changes which occurs due to the structure. So what C5A1? We know that A1 already works on arteries, left side of the heart, arterioles, and capillaries. So wherever we want to regenerate this quality of the left side of the heart with the help of metabolism, so we can use C5A1. So what it will do, it will prevent the degeneration of arteries. Okay, degeneration of arteries. So basically, that thing. Second thing is that it will, with the help of A1 is mostly concerned about oxygenated blood. C5 with the help of metabolism, structural metabolism. So wherever any degeneration occurs, so A1, C5, it will give the metabolic effect for that area with the help of A1. Structural metabolism will do with the help of C5A1. Like one wound is there, very uh, uh, non-healing wound is there. So what you want to do? You want to supply the oxygenated. So when there is, if there is any dry area, so what you want to do, if you want to smooth that area, you have to plant more water. Okay, so you have to give more water to that area, then it will become smooth. So it will work like that only. So you are sending more oxygenated blood to that wound area. So the oxygenated blood will improve the condition of that area first. Second is you are already adding structural metabolism medicine. So the structural changes will occurs then along with structural metabolical changes occurs of the wound will happen with the help of C5. So oxygen is going on, oxygenated blood is supplying, nutrition is there. So along with that, metabolical changes occurs. Okay, so not only uh, to the body, it also help to the heart, artery. So any degeneration, any things that happen to the left side of the heart, To improve the metabolical structure, so you have to add C5A1. Oh, very good. Very good remedy. Okay, we can give in the TB also C5A1 along with P2. Okay, you can give it gonorrhea. Okay, when one along with when one C5 when one A1. Okay, chronic bronchitis you can give C5A1 plus GE. Okay, so these are the conditions where you can use C5. So any destruction occurs with the help of artery. You want to reconstruct that area, so you have to add C5A1. Okay, I think you understood about this remedy. Next, come to the part of C8. This is also very important. S2C1F1. So basically, initial stage, our Dr. Kaunsizer Mati added C group remedy, S group remedy. So later on, he advised that I got results when I separated the group medicines. Okay. So if you add it, you will get the results, no issues. But more results are seen when you give separately structural and functional memory. So initially he added, so there's the reason he removed. First thing, second thing is already C2 is there, C1 is there separately, S2 is there, F1 is one, F1 is there. So why should I make the original remedy as C8? Okay. So what S2, C1, F1 do? So already we know that S2 for glands. Okay. So C1 structural changes. We already know that in the digestive system, respiratory system, cardiovascular system, nervous system, and as well as glandular system, C1 works for structural changes. F1 to give the nervine effect. To give the nervine effect, if there any problems occurs in glands due to the nervine, due to the nervous system, okay, you can add S2C1F1. So what it will do? It will improve the glandular functions. Okay. So anything like PCOD example I will give. So what you want to heal along with the help of nervine effect. So what you have to give S2 C1F1, which will improve the function of ovaries and structure of ovaries with the help of nervine effect. Okay, so this is the very good remedy for all types of glandular issues due to the nervous system issues. And other conditions can be treated with the help of this remedy. We have gallbladder, spleen, okay, and we have the livers, okay. This can be treated with the help of S2C1 additionally, okay. So I think you understood about all this things, C4, C5, C6, C7, C8. So we will discuss other remedies in next class. Okay, thank you.